First of all, I would like to thank the program committee for inviting me here. Uh, Today, I'm going to talk briefly about the current global and Korean issues in radiation safety of nuclear medicine procedure. As you know, collective effective doses and the effective dose per individual for medical exposure in USA dramatically increased by 600% and 470% in 2006 compared to early 1980s, respectively. That means most of the increase comes from the diagnostic radiological procedure in recent decade. This is a news article describing Americans were exposed to about 7 times more radiation on average than they were in 1980. According to a report published by ICRP in 2008-9. The second news article in same year showed more than 200 patients were inappropriately exposed to high dose of radiation from brain CT scan used to diagnose a stroke, and about 40% of patients lost a patch of hair as a result of overdose. In addition, there was dose-dependent radiation between exposure to radiation from cardiac procedure and subsequent cancer risk. For every 10 millisieverts of low-dose ionizing radiation, there was a 3% increase in rise of risk of age and sex-adjusted cancer over mean follow-up period of 5 years. After explosion in Fukushima nuclear power plant in 2011, concern and fear of radiation increased in public, including Koreans. This news clip in early 2015 shows necrotic fingers of a Korean orthopedic surgeon who has performed fluoroscopy guided spine injection for 17 years. This indicates led the public to be more aware of the danger of radiation, calling for measures to reduce and protect patients from medical radiation. From now, I will walk you through both global and Korean medical radiation exposure, including nuclear medicine procedure. This is the data I got from UNSCARE 2008 report and Keen's internal report 2004. Annual per capita dose from medical radiation to Korean population in 2004 was 0.73 millisievert, which is slightly higher than the global average of 0.6 millisievert and about 2 times higher than that of the United Kingdom in 2005, but it was 4 times lower than that of the USA in 2006. This table shows between 1980 to 2006, estimate of effective dose for individual from in vivo diagnostic nuclear medicine imaging increased by 50%, and collective effective dose increased by 620%. Indicates increase in radiation exposure from nuclear medicine. Examination was comparable to that from all medical procedure. Lower histogram show a marked shift in the type of procedure, with cardiac examination dramatically increasing from 1% in early 1970 to 55% in 2005. But cardiac examination take up almost 85% collective effective dose. This is because cardiac study are a relatively high dose procedure. This is Korean data from 2002 and 2004, as in the USA cardiac and bone examination constitutes a major portion of the nuclear medicine procedure. Cardiac examination accounts for about 60% of collective effective dose in 2002, but in 2004, cardiac examination decreased, but fluorinating FDG capacity examination began to increase. This graph from report of 3 Korean laboratories illustrated increase annual frequency and annual per capita effective dose of medical exposure from 2002 and to 2013 in Korea. Annual frequency increased by about 270% and annual per capita effective dose by 170%. This increase procedure using medical radiation and accompanying radiation exposure are on the rise in Korea. And in Korea, the most noticeable phenomenon between 2006 and 2013 is the marked increase of over 800% in PET-CT scan in accordance with increased PET-CT penetration rate of over 200% during the same period. The reason for this marked increase is the initiation of reimbursement for PET-CT examination in June 2006. Let me shift gear a little bit. This slide shows the process of the implementation of the new international standard for radiation protection into the national legislation and regulation. In 2007, the new recommendation of ICRP was released. Subsequently, based on the ICRP recommendation, IAEA published new basic safety standard in 2011. In December 2013, EU and Korea simultaneously based the revision of their regulation on new IAEA basic safety standards, reflecting the latest international safety standard. In Korean regulation, revised in 2013. Medical safety control section was completely revamped to add medical exposure, notion of the justification and optimization, responsibility of user, quality control of medication, safety management of patient administered with radioisotope, and pregnant and breastfeeding women. Let me briefly explain the justification of medical exposure. In 1990, the notion of justification of medical exposure was first introduced. The 3 levels of justification of patients in medicine were announced in 1996, ICRP 73. Level 1 is justification of practice. Level 2 is generic justification of defined procedure. And level 3, justification of procedure is for an individual patient. ICRP Committee 3 Working Party currently preparing for revised drafts of justification document. IAEA and European Commission organized a joint workshop on the justification of medical exposure in diagnostic imaging in Brazil in 2009. And the topic addressed in the workshop were referral guideline, communication and risk, audit, and justification. A technical meeting held in 2010 launched the international campaign AAA, awareness, appropriateness, and audit, to strengthen justification diagnostic imaging. An exemplary case of justification of medical imaging is ACR, appropriateness criteria, that covers 208 clinical conditions. Another exemplary case of in United Kingdom, IREFER system run by the Royal College of Radiologists, providing over 300 evidence to guidelines. In Korea, tools to implement justification of principle in medical imaging in field of nuclear medicine are currently being developed as suggested by IAEA, Integrated Regulatory Review Service Mission Team, to justify radiological protection on asymptomatic individual in a health screening program in Korea. Asymptomatic individuals should be informed in advance since November 2014 of the effective dose before fluorinating FDG capacity for cancer screening. Next, I will tell you about the current state of optimization of medical exposure. In 1996, ICRP 73 recommend use of a diagnostic reference level, which is an important tool for optimization of medical imaging. Since ICRP Committee 3 Working Party review diagnostic reference level in medical imaging in ICRP supporting guidelines 2 issued in 2001, the draft document for diagnostic reference level was pronounced. For the first time in Korea, diagnostic reference level in nuclear medicine imaging were developed by Medical Radiation Safety Research Center in collaboration with Korean Society of Nuclear Medicine this past year. Diagnostic reference level were established for 41 diagnostic nuclear medicine image examination performed in 155 Korean hospital in 2013. From now on, I will briefly introduce international activity on radiation protection of patients. ICRP Committee 3 works on protection in field of medical imaging and procedure. The Committee 3 had pronounced several ICRP publications as shown here, and has been drafting the diagnostic reference level in medical imaging, and it is to be published soon. The website on radiation protection of a patient, PRP, was released in September 2006 as part of IAEA International Action Plan for the radiological protection of patients. In the PROP website, the nuclear medicine field provides the following information standards for topic on the main responsibility, diagnostic nuclear medicine, and therapeutic nuclear medicine, and finally, biomedical research. one call for action was the adopted international conference organized by IAEA and co-sponsored by WHO in Bonn, Germany in December 2012 to improve the radiation protection in medicine in the next decade. The Bonn call for action contained 10 priorities for radiation protection in medicine. The first priority was to enhance the implementation of principle of justification. The second priority was to enhance the implementation of the principle optimization of protection and safety, and so on forth. WHO launched global initiative on radiation safety in healthcare setting in December 2008 to mobilize the health sector in the safe use of radiation in medicine. This initiative complemented the International Action Plan for Radiological Protection of Patients established by IAEA in 2002. One of the multi-society campaign, Image Gently, which was launched in 2008, is an initiative of the Alliance of Radiation Safety in Pediatric Imaging. The goal of Image Gently is to lower the radiation dose in children undergoing medical imaging. Following each goal, the Society of Nuclear Medicine and Molecular Imaging, SNMI, initiated a campaign entitled Go With Guideline to Child's Size Radiopharmaceutical Dose. The second example of multiple society campaign is Choosing Wisely. It's initiative of American Board of Internal Medicine Foundation to reduce overuse of medical tests and procedure, launched in 2012. Following the goal of choosing wisely, SNMI recommended 5 questions physicians and patients should ask. The first question is the health individual do not use PET-CT for cancer screen. The third example of multiple society campaign is Image Wisely, an awareness program of the American College of Radiology and the related society. This campaign was launched in 2010 to lower around amount of radiation used in medically necessary imaging study in adults. SNMI seek to achieve the goal of Image Wisely and the following 4 aspects: general nuclear medicine, nuclear cardiology, PET-CT, and nuclear medicine physics. European Association of Nuclear Medicine, EANM, issued a pediatric dosage card in 2007. In nuclear pediatric radiopharmaceutical administered dose, 2010 North American Consensus Guideline for Pediatric Radiopharmaceuticals administered doses were published in 2011. EANM revised each pediatric dosage curve to reflect difference in between these 2 guidelines. SNMI launched the Nuclear Medicine Global Initiative during the EANM annual meeting with leaders from 13 nuclear medicine organizations in 2012. The initiative focused on harmonization of pediatric administered activity guideline, resulting in a report of the first nuclear medicine global initiative project in 2015. The Korean Alliance for Radiation Safety and Culture Medicine was founded September 2011. 6 months after Fukushima nuclear power plant explosion, to promote, educate, and campaign medical radiation safety. This campaign, called Image Green, was carried out for children and the public of this alliance. The Korean Society of Nuclear Medicine raised awareness of radiation protection in nuclear medicine by giving lecture on field at the April 14th, 2014 annual symposium. KSNM is working to strengthen guideline protocol nuclear medicine imaging and developing appropriateness criteria. MRSRC initiated a campaign for radiation safety in medicine to children and the public who participated in the symposium hosted by Korean Nuclear Alliance in July 2015. Okay, I think that's all I want to show you today, and I really appreciated your attention. Thank you.